You're listening to Health Beat. On March 22, 2010, President Obama's healthcare legislation was passed into law.
Today, after almost a century of trying, today, after over a year of debate, today, after all the votes have been tallied, health insurance reform becomes law in the United States of America.
Under this bill, coverage expanded to include an additional 32 million Americans. However, many of the provisions of this new health bill are not expected to go into effect until 2014. And much of that medical care provided will be focused on preventing disease to help reduce costs. For most Americans, this means that we all have to take a more active role in our well-being by monitoring our health status on a much more frequent basis, such as watching our blood pressure, keeping frequent track of our blood sugar, and getting to and maintaining a healthy weight. While a visit to the doctor's office can cost both time and money, one place you can get those services for free or at a greatly reduced cost is a HealthFair. Health fairs are these community-driven events where healthcare providers and vendors come together in one setting, usually a community center or a local school, and they set up booths where anyone can go for free consultations, information, and advice at no or greatly reduced prices. Most health fairs are held annually and are often sponsored by lay community groups or civic organizations. These fairs usually consist of health education activities combined with multiple testing or physical examinations given by healthcare providers and professionals such as doctors, nurses, dietitians, ophthalmologists, disease specialists, and health department representatives, just to mention a few. Health education activities can consist of something as simple as a free pamphlet or booklet, or they can include a series of seminars and presentations about a given disease such as diabetes or high blood pressure.
As he said, I'm Leona Dormer. I'm the Executive Director and Founder of Shepherd's Care Medical Clinic.
At a recent health fair sponsored by Project Direct here in Raleigh, North Carolina, I observed a multitude of people moving from table to table, getting their health checked by all manners of health professional volunteers. At one table, I watched as Dr. Ngame Allen, Dean and Director of the Center for Allied Health and Health Disparities Institute at St. Augustine's College, checking blood pressure of an older man.
What are your initials, sir? Yes, how old are you?
It's a young lady, 46. Have a seat right here.
Okay.
Let me review your
I'm a year older than you are. Let's see the legend.
You got badge, put that wrong on here.
Let's see. I'm a year older than you are.
Okay, that's something.
Okay, just keep it steady, okay?
When Dr. Allen completes taking the man's blood pressure, she gives him the reading and takes the time to explain what it means.
141 over 88. The bottom number is a little higher than it should be, but not too badly. But you're sort of like in the pre-hypertension. What other medications are you taking? That's it. Okay. Yeah. So what you need to do is keep an eye on your blood pressure. Okay. Because keep a check on it. The diastolic number, which is the lower number, which is the pressure inside your heart when your heart is in a relaxed state. This number should be below 82.
The man picks up this information, thanks Dr. Allen, and leaves, but is quickly replaced by a group of people from a booth just across the way. These are vendors who also want to get their health checked.
How did y'all hear about HealthFair?
Oh, we're at the NAMI booth. By there
Oh, so you're taking advantage of this. Good move.
Yep.
That's smart.
National Alliance of the Mentally Ill. Yep. That's what we're here for.
Okay, sweetie, let me check your wrist.
Oh,
Left.
this
Okay,
way.
I'll give yours. So we take a second. Give me your wrist.
Feel a
What I
little
want you to
pressure.
do is lean forward. Just rest your arm here.
This is kind of cool. It's like handheld.
It's easy. Yeah.
What this do
The
is
vendor getting her body fat percentage checked seems amazed at the device being used. Years ago, technology like a portable, handheld body fat analyzer did not exist, and health fairs were much harder to organize and set up.
I don't have an orange one.
And you said you're 5'7".
I'm not worried about this.
Okay, well he's doing his now. And let me do your body mass index while we wait on that. Go ahead, please.
When you first get up, you eat anything.
It's pretty good.
It's H1N1.
Oh gosh, there's
We'll take your word for it. It's okay.
There you go. That's yours. I'll go ahead and get her
Your body
body
mass
fat.
index
Peggy.
is 21.3. Excellent.
Yes. You're doing my body.
Here,
Thank you.
she needs to get her BF percent. Go ahead, and he'll fill it out in here.
When a small break in the action appears, I decide to ask Dr. Allen a few questions. So, Dr. Allen, how often do you volunteer at these health fairs?
Because of our health disparities program that we conduct through St. Augustine's College, we have ongoing community outreach programs. So as a part of that, we usually try to do one every quarter. And the other ones that we get invited to are just random invitations we get from community volunteers and community agencies, churches, or other groups interested in health and intervention programs.
Now, this particular health fair was through Project Direct and has something to do with diabetes. So what brought you here? What was your interest in coming here today?
Well, years ago when Project Direct started, I was actually an active volunteer. And one of the things that I did, I was the chair of the diabetes care team, and we did a lot of neat interventions. One of them was increasing foot exam by just simply making a flyer on a neon color flyer about if you're a diabetic patient, please take your shoes and socks off. Just by simply doing that, we increased the foot exam based on the medical record reviews that we did. We increased it from 10% to 70%. So I've been involved with Project Direct since the early 1990s. And I've always been an advocate for diabetic patients. And I lost my mother to diabetes. And diabetes and the diabetic patients are very important to me. And I do believe by becoming a volunteer who will spread the educational information to the community members. Health literacy is very important in intervention of any disease. The more the patients understand about their disease, the better and the more compliance you get out of them. So that's one of the reasons I come.
Okay, that's a pretty substantial reason. I noticed that you're taking blood pressures and looking at body fat composition. Why is that? Why are we focused on that today?
Well, I mean, blood pressure, especially for the African American community, is one of the primary reasons of renal failure. And a lot of times people have hypertension and high blood pressure and don't even realize it. And we find that, I can say based on my own experience, maybe about 30 to 40% of the patients or people who come to these health fairs, they don't realize that they have a certain disease, either diabetes or hypertension. So it's a good thing to get checked and realize. And if the reading is high, we usually recommend we give them the writing, we give them the normal values, and we always recommend that they go see their healthcare professional. I actually would love to have a system in place if I had the help to actually follow up with the community members and to check and see if they did go to their healthcare providers and be further checked.
Well, what would normal readings be? What should people be looking for?
Well, the diastolic and the systolic is the upper number. And that's the pressure of the heart when the heart is in a contracted state. So the top number should usually be below 140. The lower number, which is the diastolic blood pressure, the diastolic blood pressure is the pressure of the heart in a contracted, in a relaxed state. So anytime you have an elevated diastolic pressure, it's more of a concern to someone that we check in a community health fair, because if the chamber, usually when you have hypertension, the lower left hand chamber, the left ventricle, if the muscle has to work really hard to pump the blood out, well, just like any other muscle, when it gets exercised like that, it's going to get thicker. So the thickening of the left ventricle muscle causes reducing the volume of the chamber itself. So the blood volume coming through the left ventricle and being pumped out is going to be reduced. So the efficiency of the cardiac function is reduced. So it affects the amount of blood going out. So, and also it increases the pressure.
So it's a combination of a drop in volume of blood being moved, and then the pressure hurting damaging the kidneys.
Exactly, and we'll see the pressure itself will cause blood vessel wall damage. It actually in the areas where the blood vessels branch off, there's a branching of the blood vessels. Just the high pressure can cause damages to the wall of the arterial walls and the blood vessels, and that's where we usually see plaque formation, because the immune system reacts to the damage, and we see fatty deposit and sometimes blood clots on top of the fatty deposit, and getting the more dangerous form of plaque, which is the soft plaque, which is the blood clot. And sometimes when that's dislodged, it can go and cause infarction in the heart and also cause stroke, in the brain. So it is a significant problem. We have to make sure that people who know they have hypertension get treated immediately. And with the African American community, that's a big problem, because genetically they use salt very efficiently, and with the Western diet and the types of diet that people have adopted in this century is higher in fat and higher in salt. So that's a very bad combination, and long term, and their kidneys are more vulnerable to the blood pressure. Usually in a Caucasian patient, when we see renal failure, it's usually due to diabetes or even polycystic kidney or some hereditary disorder. But in the African Americans, even though diabetes is a problem in that community, but more of the devastation is from the hypertension. So the primary reason African American patients end up losing the kidney function is due to blood pressure. So it's a very important problem for us to address.
Absolutely. What evidence have you seen that these health fairs are helpful, that they've had an impact on the community?
Well, just the mere fact that you tell someone, oh, your blood pressure is high, let me check it again. You check it again, then you consult another a booth, informational booth. If you have a physician on site, you usually ask them to come and let them check it. And when it's still high, then we inform them that this problem of high blood pressure is a problem that they need to address immediately if they want to keep the kidney function preserved and the cardiac function. So.
And you've seen, you've had patients that you know of personally that you've seen this help, HealthFair actually help?
The ones that I actually knew as community members, and I would follow up just as a friendly reminder, yes, most of them would go and be checked. But as I said, I would like to have a system in place where we could have their phone number and their contact information, and just call them to follow up with them and see if they indeed did something about it.
So would you suggest or promote going to HealthFair with the community then? Do you think it's a great idea?
Absolutely. I truly think that the other reason for going to health fairs is that you understand and find out about a lot of free resources that are available for people with chronic diseases or whatever issue is that the health fair is for. If it's a if it's a focus on breast cancer or prostate cancer or any other types of chronic conditions, there's always a great idea to go and get more information. The more you know, the better health outcome you're going to have. And the other thing is that if you do not have the financial capability of getting your hands on certain resources, that's a good way of finding out what is out there that the community members could use as a free resource, or even a resource that their insurance may take care of. So just the simple fact that you can get a blood glucose check, or you can get your body mass index. You know, we talked about body mass index. Diabetes and hypertension is more prevalent in people who are overweight and obese. And even getting a free nutrition consult, you know, things that people sometimes have to pay to get, they can get it at HealthFair for no charge.
Yeah, that's one of the things I've noticed, and I think is a great idea. And one of the reasons we're doing this particular podcast is so that people can get an idea of what to expect at a health fair. And it's kind of crowded, but the wait's nothing. No wait basically wherever you go. There's usually quite a few people here. So.
And plus, it's almost like it's fun. I know, some people may say fun. Yeah, well, it is. Because when you live in a community and you see your friends and family members, and, you know, you have a day where children can have fun, it's a fun day, you know, and it's a good activity for a family to even go together. And actually parents to teach children to have better choices of food and modify their, some behavioral changes, importance of exercise. So there's always something good that can come out of it.
Well, thank you for answering the questions, and I hope the rest of your day goes well.
Thank you very much. I'm glad to do it.
Moving on past Dr. Allen's table, I see another healthcare provider, and she agrees to talk to me. Okay, and if I get your name.
Toby Bowen, Tobibowen.
Okay. Hi, Toby. Can you tell me what you're doing here at the health fair today?
I'm with Resources for Seniors. Resources for Seniors essentially functions as Wake County's Council on Aging. Everything we do helps seniors stay in their home for as long as possible.
This is one of the. Do you come to these health fairs often, or is this the first time you've been here?
It is the first time we've been at Project Direct's event, yes, but we do all kinds of events within the community. We have a speakers bureau that goes out and does outreach and talks about all of our services and senior-related services. One of the common things that people really need to know, as far as we're concerned, is the continuum of care. And the continuum of care is what happens as people age and being ready for what happens, because most people don't know what's available within the community, and we educate about that.
What's the most common problem you hear at these health fairs from people that come?
These fairs are...
Yes, this type of fair. What's the most common problem you've heard?
The most common thing that we hear is that people don't know about our services, and they don't know that we're available, and they don't know what services are available within the community. And that's why an event like this is great, because people can really network and understand what's available out there.
Okay. So would you recommend that people to come to these health fairs and take advantage of this stuff? Or
community events are very important for people, because most often what they concentrate on is what is top of mind for them. So if they're having a certain health issue, then that is what they're worried about. But you never know what happens tomorrow. So coming to an event, just finding out information and learning is a wonderful tool for people, and having too much education has never been a problem for anyone.
well, hopefully, there's some people I wish took that to heart, but I've met a few. After speaking with Toby, I see another vendor who appears willing to answer some questions, so I move over to her booth. And let me get your name.
Sally Ullman.
Okay, Sally. Is this your first health fair, or you've come and worked at, or?
No, Project Direct did a health fair 2 years ago. It was in another venue, and we had a very successful event.
How important do you think these are for the community?
I think extremely important. Extremely important. It's a way to make people aware that a lot of services exist.
So, what's the most common question you get asked at these? The most common problem?
Common problems? Well, I think I really can't say that right now because I haven't been privy to all of the questions. But I'm sure I think I would say that it's access to care, which is what this seminar is about.
Yeah, if you read the news, news accounts, access to care is really hard. I mean, I keep hearing about places that have these where people show up 2 days in advance and stay in line overnight just to get health care. Usually that's the rural areas. So, I'm surprised at what I see here, that there's not more people taking advantage of this. I often wonder if they just don't know it's here.
That's very possible. And I think one of the problems is that there are so many people who are not insured, who are uninsured, and even folks with insurance sometimes have a difficult time because some practices don't take Medicare. And
yeah, that's a shame too. That really is. I mean, especially when you consider how our population is aging now. I'm getting up there in age, so I tell my students that I teach very often, I want you to have good jobs. I need you to support Social Security because I'm going to be retiring in a few years.
Sure.
So, I try to hit them with that.
That's right.
Yeah. So how big of a problem have you noticed diabetes in our community here locally?
I think it's been a huge problem for a long time. Lots of people have it, and some people don't know they have it. Sometimes it hits families, and it's serious, and it's a very difficult disease to control.
Sure. I have been being diagnosed diabetic myself. It can be problematic, but I'm fortunately caught in time. Just diet control.
Oh, that's
medication.
wonderful.
Yeah, so it's been doing pretty well. I think these health fairs are extremely important, and when I talk to individuals about these things, they please go. They just don't seem to have heard about them. So maybe we just need to do a really better job of getting the information out there. So
I agree.
all right. Well, thank you, Dana, and
Sally.
I'll let you know when this is on.
Okay.
And there you have it. What you can expect to see, hear, and do at a health fair. Thank you for listening to HealthBeat.